everyone, this is Professor Zeller, and I just wanted to do a quick recording about the outcomes assessment form to give you a basic rundown of what I'm expecting and how to make this easier for yourself and not harder as you're preparing to turn this in on September 17th. Please remember that due date. It is right here, mentioned several times on the course information website. So please turn it on time. If you're having issues completing it, you can let me know at least 48 hours in advance for an extension, and I'll be glad to do so. But let's try our best to get this done on time so we can go ahead and work on the rest of our project throughout the semester. So this is basically an introduction to your project that you're going to be doing, which is pretty much the bread and butter, the meat of your semester, what you're doing your practicum for. So it's very simple assignment. Don't think too hard into it. Really, we're just trying to set the foundation for your research project. You have a literature synthesis and a project charter, as well as your presentation, which is due later in the semester. So we want to make sure that this is completed and it is solid so that you don't have any problems running down the road. Because I have had students in the past who have really not done a great job on this, kind of checked the box, gotten through it as quick as they can, and realized that the research they were doing, the information that they provided was not sufficient for the problem they wanted to address. And therefore they had to start over and redo their assessment, their outcome assessment, which caused them a lot of time, a lot of stress, and those are things you don't need because you all are busy getting your 384 hours this semester. So, outcome assessment, what are the basic portions? You want to find a measurable outcome. Go to your unit. Usually units will have a problem board, maybe a board that has information, statistics about how well they're doing, how bad they're doing. Look for things like CAUTIs, CLABSIs, fall rates, patient satisfaction scores. Those are great ways to start. Go ahead and look at those. If those show problems or you're not meeting a benchmark, that's something you can work on. If that doesn't work, go to your preceptor. What does your preceptor see as an issue? What do you see in the clinical environment that's an issue? See lots of people with pressure ulcers? That's something to look into. Maybe that's a problem. Once you do that, you need to explain how you found it, which we just went over, and then you need to find some data. That data usually is on those boards that I talked about, or you can reach out to the manager of the unit and ask for them to put you in contact with whoever does the surveillance and monitoring and their unit. Who collects this data that they use regarding the safety on their unit? That's going to definitely come in handy for you. So you need to identify where this information comes from and get solid statistics that you can use to show that this is a problem. You then want to compare that data to national, regional, and local statistics. So is this an issue? Are we actually performing better on our unit than the regional and national data, or worse? If you're performing better, it may not be something that you really need to investigate, but if you are performing at the same level as the national statistics or worse, that means that you have a good problem and you need something to address that issue. So that would be perfect for an intervention. Sources of the data. Once you find this information, please cite it in APA formatting. I can't stress that enough. I have a lot of students who don't have time and they do not focus on their APA. I grade APA very strictly. I've been doing it for many, many years now, so please, please, please use APA that is accurate or you will get points taken off. We need to describe your microsystem. What type of patients do you see on your unit? So for 3 South, where I used to work, for example, acutely ill geriatric patients. That's it. For you, it may be patients and post-surgical patients who are in recovery. It could be neurology patients who are in the step-down unit. It depends on what unit you're on. Then you want to, describe the intervention that you're looking at. So say you're on your unit and you find out that falls are a huge issue. What intervention is your unit currently using? Are they using falling stars on the door to tell you that someone's a fall risk? Are they giving everybody a fall information pamphlet when they come in? Are there ceilings on the tile, are there tiles on the ceiling that say watch your step when patients are staring at the ceiling? Those are all ways for you to see what is currently being used on the unit and whether or not it's a effective intervention. Then you need to describe what your intervention is. The way I would do this, before you go ahead and say, this is definitely what I'm going to use, I'm going to find a way to stop falls, you need to find research that supports your information that you want to present. So I have an example. Go to Greenblatt. We've all been there. Here's your database on Greenblatt. Use the database that you like. So I usually use Galilei or Senol. Works for me. Whatever works for you, choose it. Excuse me, y'all. So once you get in there, you want to go ahead and do your search. So what is your search methodology going to be? So for me, hold on, y'all. My computer's about to die. Let me find my. All right, sorry. Computer's about to die. Let me find my plugin. Okay, so for me, what you need to do is you need to find out what your population is, what your interventions are, and then what you were trying to measure, so what's your outcome. Once you find those things, plug them all into your search database. So when I was in the DMP program, I did research on smoking cessation and whether or not abrupt cessation or gradual cessation was more effective in patients maintaining abstinence after they stopped smoking. So when I did that and I did a search, look what came up. Meta-analyses on the effectiveness of gradual versus abrupt smoking, a randomized control trial, NRT-aided gradual versus abrupt cessation. There are thousands and thousands of level 1, level 2, and level 3 evidence that can be used for this project. Based on my search, boom, I know that this has actually been researched before, and I'm going to find great data that supports whatever intervention I am looking at. So if you do a search like this and it is not fruitful and you do not get results that work for you, or you get very few results, probably not a good question. You may need to reword your question, or maybe you need to find something new altogether. Maybe it hasn't been researched. This project is to find an intervention that has worked and has been researched and to apply it to your unit. So if it has not been researched before, you can't use it. You need to find something that you can actually research and find great journal studies. So going back, so once you find some information, you need to write down the evidence. So find 4, 5, 6 good journal sources. It could be meta-analyses, it could be case studies, it can be randomized control trials. Write them down in APA format, go ahead and print them out, look over them, see what the evidence shows. You need to, of course, like I said, identify the level of evidence. This is important. I prefer level 1 through 3, but in certain instances, there's other forms of evidence that are sufficient, even though they're not maybe blind, or maybe they're just case studies or cohort studies. That's okay. But we really want to focus on levels 1 through 3. Use Stetler's evidence hierarchy. You all have done this before when I believe when you took your research class, which should have been in the spring. So adhere to that. And finally, once you find that information, you got those 5 articles, right? Read through them, summarize them, see what the information says. If you're good to go and you feel like that is sufficient and you have enough information to support yourself in front of your colleagues and your peers when you present this at the end of the semester, then go for it. This is when you need to really solidify that PICO question. When I was in the CNL program, this was my PICO question. Not the best, honestly. Looking back, I feel like it was way too specific. My interventions were really not measurable enough, but I compared bowel management education versus no education and how it impacted bowel health for patients that were on clozapine. So patients that are on antipsychotics like clozapine, bowel obstructions, ileus is extremely common. They were not educating patients when they left. A lot of patients were taking too much medication, stopping medication, weren't watching their eating habits, weren't taking their laxatives as or stool softeners as requested, and they were dying. There's actually a large amount of patients that had passed away in the community because of bowel obstructions related to their medication regimen. So this is how I did mine. Very simple, wrote it out in paragraph form. Then I went and I identified each part of my PICO question just to make sure that I had a firm understanding of what I was going to be researching. So please do this and include this in your outcome assessment. Very easy, very simple. If you need help with this, reach out to me. I will be glad to show you how I would do it. And if maybe sometimes the wording may be a little off, we can maybe adjust it, move it around so that it works for you and it's easy for you to research. So that's it. If you look at the example that they gave, this is one of my past students. It's on D2L if you want to look at it. Very good research. Not difficult to find information on either. Basically, they wanted to see how patients perceive the responsiveness of staff. This is based on HCAHPS, which is a survey we send out to patients about their satisfaction for their stay. This actually dictates how much funding we get. So if we get poor scores on HCAHPS, our hospital gets less funding from the government. So this is a really important topic. As you can see, this unit, only 57% of their patient population said they were always satisfied with responsiveness of nursing staff. Whereas national information showed 78%, and regional information showed 64% of the same benchmark. That just means that AU is far beneath. So AU needs to improve. Great topic. This is something, obviously, whatever they've been doing on their unit has not been working. They need a new intervention to see if they can improve these outcomes and improve the amount of money that's coming into the hospital and to improve the reputation and the rankings of the hospital. So you can see their data here, very simple, straight to the point. Just do bullets and make sure you actually include your sources. This source is not an APA, y'all. Please include your sources in APA, that is huge. Microsystem, adult medical surgical unit. I would even go maybe a little bit more in depth. That sounds a little bit simple, but if you have a specific type of patient that's usually in there, that's cool. If not, just keep it basic. Description of current intervention, call light use, that's all. And then they include the trends for every month, which I think was pretty neat. And then they talk about their intervention. Their intervention is hourly rounding. So they want at least one hospital staff to visit the patient once an hour to care for the 4 Ps, potty, pain, position, possessions. Excuse me. They've listed some evidence. They found some studies that they used that showed whether or not the intervention was effective. Great information right here. Very simple, straight to the point. I would prefer that you use maybe 4 to 5 bullet points and include evidence from each of your research articles that you find. So I want to see all of your research articles, a basic descriptor listed here. It doesn't have to be in depth. It can be one sentence saying this is what the research found, but I want you to include all of that for me. And then your PICO question. Please write it out, regular PICO question. And like I said earlier, I would really prefer for you to go ahead and underneath it, break down the P, I, C, O, and T. I'd like to be able to see that written out as well. This is it. Looks really simple, not difficult to do, but it definitely takes some background work, and you need to put time into this and not just rush through it, because I want to make sure that you all are set when all these other assignments come up. This assignment, a lot of the assignments for this semester are about 30% of your grade each. So if you don't do well on one assignment, it can really hinder your progress throughout the semester and give you some anxiety about passing the class. I don't want you to worry about that. We're all going to pass. We're all going to do great because we're going to work together. And if we have any problems, we're going to make sure that you reach out to me, I reach out to you, and we mediate whatever the issues are and make sure that your project is on the right track. So before the 17th, if you are unsure of your project, you feel a bit of uneasy, you can't find information when you do your database search, reach out to me. We can talk about ways to change your question, refine your question, and different databases you can use to make sure you find a good 4 to 5 solid research journals that you can use that support your intervention. If you need extra time, as I said before, please let me know 24 to 48 hours in advance. We can give you a little extension as needed. I know you're busy with clinicals, home life, everything in between. Totally get that. I've been in your shoes before. But I would prefer for this to be turned in by the 17th so we can go ahead, get approval, and start on our project, because that's really what we're here for, right? So I hope this gave y'all a pretty basic overview of the course. When you do turn this assignment in, please label it appropriately. I think it's over here. So for example, georgebluff.facultygroup.outcome assessment. So your name, my name, Zeller Group, outcome assessment. They're strict about that. We have to deduct points if it is not titled correctly. So don't lose an easy 5 points, right? Go ahead and just follow directions, submit it to my folder. And I'm generally very good about grading these. I grade them fast, I grade them in depth, and I will get back to you as soon as I can with your grade, as well as a sheet explaining your grade and explaining ways that maybe I think you could improve your question. So this is a process recording form. This is the outcome assessments form. Pretty straightforward. I know some of this may be just repetitive, but I wanted to show you how I would approach it, how I would do a simple database search for research that I could use for my problem. And I just want y'all to don't overthink it. Use your resources, use your unit, use your preceptor, use your management, and find things that really need to be changed. I've had students that have done falls, bed sores, tap water versus normal saline for cleansing wounds. Literally anything you can think about. I've had lots of different research projects that have been done, and they've all done fantastic and all passed the semester with flying colors. So good luck. Email me, call me if you have any questions, text me. I am available 24/7. So please let me know any questions y'all have. Thank you.